much, Kristen. A stunning report recently found that reports of overdoses of popular injectable weight loss medications has risen significantly over the last few years. The study comes as rates of use have increased by more than 200% in recent years. Dr. Stacy Marshall, medical toxicologist at UAB and the Alabama Poison Information Center, joins us. Good to see you. Thanks for the time. So this study conducted by researchers at UAB. So what do you think is behind the rise, and what sort of symptoms may patients experience?
Yeah, so I think over the last 5 years, the prescribing patterns for these medications have really skyrocketed, just because they have been shown to be very helpful in many diseases such as diabetes and in supporting weight loss. But there's also a few aspects of these medicines that I think uniquely position them to increase the risk for medication errors. So one being, most of them are subcutaneous injections, which is just is new for a lot of patients, I would say. And most oftenly, they're actually dosed weekly rather than daily. So there can be confusion around the dosing frequency as well.
So you're saying folks it's one thing that's different is folks have to give them to themselves.
Yes, exactly. And so not everyone is used to that, and all of these devices work a little bit differently. And so understanding how to use the device is important.
What about the symptoms? What are the symptoms of folks who may need to kind of be looking out for?
Yeah, so most commonly after, unintentionally taking extra doses of it, people actually developed very little symptoms. So either no symptoms at all or very mild symptoms. And most commonly they reported symptoms like nausea, vomiting, abdominal discomfort. And so it was much more rare that people develop severe enough symptoms to require hospitalization.
All right, and let's talk about what increases the risk and how to minimize it. First of all, what patterns, what kind of behaviors would increase the risk of issues here?
I think just uncertainty around how to use the actual devices. Like I said, like every device is a little bit different. And again, subcutaneous injection, so you actually administering the medicine yourself, is oftentimes new to patients. And so having that discussion with your provider to make sure that you understand how the pen is used.
So that's a way to minimize the risk, just make sure you have a clear understanding?
Yeah, with the provider and the pharmacist can be very helpful in that front too.
Yeah, so take your time, make sure you're right there. So if someone feels they may have taken too much, what sort of steps can they take? What should they do? Yeah,
so if you are having severe symptoms, I would say, seek medical care. But you can always call the Poison Center. It's a free service. We're available 24/7, 365 days a year. And we have become much more familiar with these exposures over the last couple of years. And so we can help guide people through on what to expect, what symptoms to watch out for, and knowing when to seek that higher level of care or going to the emergency room.
Yeah, so on the front end, just take your time, make sure you get it right and understand it fully. We appreciate the time. Thanks so much for being with us.
Yeah, thank you.
An important conversation for sure. All right, as we had to break this morning, we've got a